Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hi, everybody. Welcome to this week's edition of The Holistic Nurse with Peggy Smith. I am Peggy Smith, an RN with 45 years of holistic and traditional experience. And today we're going to be talking about autoimmune diseases, which affect so many people all around the world. And there's a lot of misunderstanding and a lot of struggles with that. So I'm going to be explaining specifically, we'll be talking about CIDP, chronic inflammatory demyelinating polyneuropathy, and fibromyalgia. Those are two very common ones that I deal with in my traditional nursing practice. And I'm going to have my expert epidemiologist, Dr. Gloria Warren. She is joining us today. And welcome, Gloria. I'm happy to have you back.
Well, thanks for having me.
So, Um, so as we, a lot of times people that know this, and I don't know too many people that don't have some sort of autoimmune disorder. In a simple term, an autoimmune disease is actually a condition where your immune system, which is supposed to protect you from germs and invaders in your body, bacteria, viruses, it gets confused and starts attacking your healthy cells and organs instead. Um, and it identifies your body as a threat. And when they say you can be your own worst enemy, you certainly are in that
That's
condition.
it.
Um, Currently, there's no universal cure for most autoimmune disorders and diseases, but there are because mainly they're long-term chronic conditions. Often, a person does not find which autoimmune that they're fighting with until they've been to sometimes even hundreds of doctors. It's a mystery, and after you see 3 or 4 people for the same thing with no answers, you start feeling like you're losing your mind, and sometimes your family feels like you're just a chronic complainer, hypochondriac, and this is real. The symptoms are real. It's a real struggle for a large part of the population. Although there's no cure, it doesn't mean that there's no hope and no way to manage things. And um, modern science, and especially here in 2025, we've been doing a lot of CAR T research, stem cell research that can help. There's a lot of RNA technology, infusions, and medications that make it a lot easier to manage these conditions. So, Dr. Warren, would you like to, tell us a little bit about yourself and what you know about, your experience with this?
I'm a certified epidemiologist through Johns Hopkins. It's one of the things I do in the medical community. Um, you know, there are so many things that can help it, but let me talk about the symptoms real fast. Many people have symptoms and don't even know what's happening. Muscle weakness, I mean, you could be on the verge of actually getting an immunity disorder. But if you know what to do and it works, then go for it. Numbness, tingling in the fingers and toes, and loss of reflexes. Maybe your reflexes are slowing down. That could be age. It could be almost anything. But if you notice something drastic within a couple months, you should see a doctor. See your medical professional of your choice, of course. Difficulty walking, gripping things. Some people, they go to grab something and it's like, wow, I couldn't do that, or profound fatigue. Even if you do get a good night's sleep and you have an uninterrupted 7 hours, there shouldn't be profound fatigue. You could be, after a few nights of 7 hours at least, and you're still having that problem, there's something that needs to be addressed. So seeing a doctor is necessary. And it's not psychological. It actually is there are physical things that can make these occur, and many times autoimmune disorders are, one of the things at the top of the list. And in a society today where we have so many chemicals, coming around us in our environment, in our food, and through other people, and you just never know, unless you have it checked out. So please, see your medical professional of your choice and see what's going on if you come up with those symptoms. So it's
I
just,
think, oh, excuse me, go ahead. Go
no,
ahead.
go.
Okay. I have found in my experience, because in my traditional work, I do a lot of home infusions for patients. And I've learned a lot from the patients. You always do. We're not, I learn more, I think, from my patients than I can offer them. But I never realized until I was living in South Carolina a few years back. There's a major disparity across our country as far as the knowledge that's available, and even the resources. Typically, a patient with autoimmune symptoms, they might be treated by a neurologist if maybe they're falling a lot, or having a person with multiple sclerosis, for example, goes to a neurologist. Many of my patients are seeing allergy doctors, or just infectious disease, even because
Yeah.
you just don't know where to start. But one patient in particular, and uh, this field was been treating, replacing faulty immune systems with immune globulin infusions for, gosh, over 40 years now. My first husband used to work for with one of the research science companies, and right out of college, and he helped develop the immune globulin therapies that are so commonly used now. They do require regular weekly to monthly, on a cycle, infusions to replenish your immune system. But I went into a patient's house, just a normal home care visit. It wasn't even for an infusion. A woman was in a hospital bed. Her family was around her. It was kind of like a wake. Everybody was in tears, crying, and I thought I had the wrong house. My paperwork didn't say that there was a problem here, just an intake visit. And I asked what was wrong, and she said, my doctor said that he hasn't seen this disease in 60 years of his practice, and that in 2 years I'm going to be totally bedbound and need total care. And I said, well, what is your disease? I mean, I was here from the insurance company. She said something called CIDP, chronic inflammatory pulmonary, and this is not near a major city like I currently live in now. So I said to her, I said, I'd like you to know, first of all, your doctor could be commended for recognizing this. I know he doesn't see a lot of patients in this part of the country with this.
Mhm.
Doesn't mean that they aren't there in that part, just not frequently diagnosed. I said, but if you were living up in Philadelphia, where I'm from, I said, there might be 3 or 4 people on your street that have the same diagnosis. And I said, they go to work every day, they function, they have to do certain things to manage the symptoms, but your outlook is very optimistic, and I can give you some resources for that. But another patient in the same part of the country, I went in to do an infusion for immune globulin, and she happened to mention, she's 21 years old, that she had 30 different autoimmune disorders. I, in my ignorance, I didn't even realize there were 30. And this poor girl had lost both her parents to complications from them. Um, I learned at that time type 1 juvenile diabetes is an autoimmune disorder. I did not realize that at that point in my career. And she had the CIDP, she had fibromyalgia, she had just a whole gamut, everything about except maybe MS. They hadn't been diagnosed with that, fortunately. And she was very positive. She was getting ready for her wedding, and she was so grateful for the research that was out there. Uh, but it's a long road getting to a diagnosis. Dr. Google is not always the most helpful. Your primary doctor is probably the best place to start. And if your symptoms are respiratory, maybe a pulmonologist, maybe neurology if you have neurological symptoms. Um, but but there's a lot of hope out there, and that's what we're hoping to convey. We're going to be talking mainly about CIDP and also fibromyalgia, because that is a very debilitating, painful experience to live with.
One thing to consider too is if you see your primary physician and they're not going anywhere, primary physicians are great. They're the first stop to most anything, medically speaking. But at the same time, not one person can know everything, and you may wish to switch perhaps to a different one, or maybe bring her some of your research and say, hey, I ran across this. This is the exact symptoms I'm having. I found it on Google, or whatever. And, I really think this is something I need to look into. Can we do a test? Can we do something for that? And they're, if they are like, well, no, I don't think that's the problem. Maybe it's time to switch, because you need a physician that's a partner with you in your own personal physical well-being. And if they're not going to partner with you and observe your knowledge and what you have, you live in your body every day, every second of the day. And if you can't have somebody that understands what's happening in you, maybe it's time to switch. I've had people that needed to switch, and they did, and they actually got their referrals to go see an immunologist. And that's the other thing. It's the immunologist that's really in charge of finding out and helping out with your immunity. So that's your target specialty physician. So, keep that in mind as well.
And I think too, it gets back to following your gut. What that you're not crazy, that something really isn't right. You weren't born like this. Although there is a genetic component to having autoimmune issues. Asthma is one, typically the diabetes, of course, runs in families. There's multiple sclerosis has a genetic condition. Um, so there are tests that actually can measure and find out, that you're in the right pew at the right church, when you're looking for your answers. Um, and it's not normal to just suddenly lose muscle reflexes or be tripping all the time. If you have that profound fatigue that Dr. Warren mentioned, you tend to think, oh, I guess I'm depressed. This has been a long process. And yes, that has to be kept in mind, but certainly the struggle can cause depression, and frustration. Um, but there are lots of choices. And there's also, we can't leave out without finishing our show today. We'll talk about some holistic things you can do to manage your symptoms. CIDP, I think, is more specific than the fibromyalgia. You've got a little bit easier to diagnose and, get blood tests and everything. Fibromyalgia, it's not a classic autoimmune disease, but it's real. It's a central nervous system pain processing disorder. And Gloria, would you like to explain exactly, what's misfiring in the pain process there? How does
Well, there's no structural nerve damage actually, whereas in the CIPD there could be. In this case, what happens is the brain and the spinal cord, they amplify pain signals, and it's not a normal state of amplification of pain signals to the brain. So as they say, the pain is like the volume knob. It's turned up too high, and you feel the pain at a higher level than what you should. That's why some people, they can have a broken finger and they can still function. Oh, I'll just tape it up and do this and that. And somebody else, it's like, I can't do this. I got to go see the doctor. It may not be that they just can't feel, they don't have pain tolerance. It could be their pain levels are just turned up way too high. So that's something that really needs to go, and you need to be treated for that.
So we're going to take a brief break at this moment and come back and continue this discussion because pain is very debilitating, especially when you don't know its source.
Yeah.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to easysense.com and learn how, with your help, we can fight these horrific brain disorders. That's easysense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Hi, welcome back to this week's edition of The Holistic Nurse with Peggy Smith and Dr. Gloria Warren, epidemiologist. And we are discussing autoimmune disorders with a focus on CIDP, chronic inflammatory demyelinating polyneuropathy, and fibromyalgia, because those are two conditions that can be very debilitating, very frustrating, and there's a lot of hope that we'd like to offer you. We were just talking about pain. Pain in medicine used to be called the fifth vital sign. Um, our show last week actually talking about caregivers and all. You tend to minimize pain because you don't want to be seen as a complainer, or different cultures handle pain in different ways. Certain, I guess, Mediterranean type cultures, they feel that pain and suffering is somehow redemptive for your next life. Pain is not normal and doesn't have to be suffering. Many people are afraid that they go to the doctor with vague symptoms of pain. Right away, the doctor's going to assume they're looking for opioids, which are not available in these the way they used to be. So it's important to get that diagnosis first of all, so and it might doesn't mean too you might not also need some psychological support, maybe mental health services, just to help you deal with the stress that has been causing you. But the pain for CIDP, that's more of a neuropathic pain because it affects your peripheral nerves, kind of like jolting electric shock sometimes. It's not necessarily all the time, but certainly comes at in inopportune times. It's never a good time to be in pain. Um, you shouldn't have to suffer though, or and you should know just for your own psyche, that this is just chronic versus an acute problem, that needs immediate attention. Both need regular medical attention though. With fibromyalgia though, the pain, Gloria, why don't you go into explaining,
Yeah, we're like CIDP, it directly attacks the nerve tissue and the myelin sheath. See, on your end of each nerve, you have like this little gelatinous myelin sheath, and it kind of helps protect the end of the nerve because that's the most sensitive part, So by protecting it, it helps to numb some of that pain that may go through. But in CIDP, it attacks that myelin sheath and exposes it. So it's a real actual situation that they can see is happening. This is something I was born without myelin sheath on my nerves. So I had really bad shakes and stuff. And it is what it is, but I'm fine now. But in fibromyalgia, the immune system doesn't actually attack the tissue. It's more of immune signaling and inflammation and stress hormones that actually create flare-ups and nervous system imbalance that influence pain perception. So that pain perception happens at the brain, whereas anywhere in between the myelin sheath end of the nerve to the brain, you can get fibromyalgia where there's swelling, or maybe the stress hormones is aggravating something, or things of this nature. Usually, like if you have a low pH balance, this is common to get fibromyalgia in places. So, I mean, there's so many things that are triggers, but there is a big difference between CIDP and fibromyalgia. CIDP, specifically disease of an immune attack on the system that upsets the perception of pain. Fibromyalgia, condition of the nervous dysregulation due to the aggravation and eating up almost of the myelin sheath on the nerves.
Okay, so this might be a good point to bring in for as far as symptom management goes. Some of the holistic things that we do to manage, it's obviously a inflammatory type process. So, changing your diet, even though it seems totally unrelated and maybe outlandish to you, a less inflammatory diet can be helpful. They say you are what you eat. If you're eating a lot of things that inflame your body, just because you're hypersensitive already, so you might be hypersensitive to, sugars are very inflammatory. So it's all connected to each other. Some of the new energy techniques, NMT, which is neuromodulation technique, it's based on quantum physics research. It's not just hocus pocus magic, uh, without science background, but they actually have a procedure to reset your autonomic nervous system. Things as simple as hypnosis. I'm certified in, medical management of pain with hypnosis, and the pain isn't necessarily going away, but it's your perception. Even if the pain is still there and you still are aware of it, it's not debilitating. It's kind of like you're disconnected from it and you can go on with your life. It's not preventing you. um, so can you think of some other things that
Therapies? Absolutely. You can actually go to physical therapy or neuromuscular rehab. With it helps you to adapt. It gives you adaptive training techniques so that you don't feel the pain, or perhaps you know how to respond to the pain more effectively, or where it's not bothering you as much. I mean, after all, things can really bother people, especially pain. Nervous system regulation reduces sensitization and stress-driven flares. Sleep therapy, part of it. Pacing yourself, vagal stimulation. The whole idea is to calm the brain in the immune loop, and it affects the immunity, in other words. So nutritional gut support, it's anti-inflammatory diets, eliminating certain things like Peggy said. It lowers the systemic inflammation. Like she said, sugar can inflame, and many things can inflame. All your nuts, they have lectins in them. All your seeds have lectins. Certain foods have lectins, like tomatoes, potatoes, and corn. Lectins. And when you eat lectins, it creates swelling and inflammation in your body. So that can add to the whole problem when it comes to these two conditions. Complementary therapies, acupuncture, massage, like Peggy said, she does hypnosis for people, and hypnosis helps. Massage, energy-based therapies can help release some of if you get inflammation that triggers it and you get more pain, perhaps a good massage can help release some of that inflammation and get the pressure off the nerves so that they can become a little more normal. There's
for
different
people
things.
that haven't partaken and enjoyed the experience of a good, healthy, holistic massage? When
Mm,
you complete your massage, you're always given a bottle of water, and the reason is there massaging you, they're loosening the toxins and it has to get out of your body. So the water helps. And actually being hydrated helps with pain management, and water is our
Right.
cheap medicine. But these are conditions that do need medical supervision
Right.
and management. Um, we're not talking about Crohn's disease and some of the gut autoimmune things, but those are autoimmune also. And I remember I went to one Crohn's patient to do an infusion that was meant to build up the system that was affecting his Crohn's disease. And I just, part of my history, what kind of diet do you take? He said, oh, my doctor said I can eat anything I want. Diet has nothing to do with my gut. And it's like, okay, let's go on to the next thing here that I was there for. But it's the biologic and immunosuppressants that quiet the overactive response. But a lot of times I've had patients tell me it's been 10 years of going to different specialists before they actually got an answer to their struggles.
Mm.
And that is very frustrating because by then your family is, just they just think that you're just a hypochondriac, and you know you know that there's something physiological wrong, and it can't be that debilitating. But it doesn't mean that you can't adapt your lifestyle to continue to function. And because it's getting harder and harder, at least in our country, to access services to for those people that aren't able to function in traditional ways.
Mhm.
um
It's
so
important to know, though, that there is no single cure. Okay, just
absolutely.
effective management strategies and early intervention matters, and that begins with diagnosis, just like Peggy mentioned, especially in progressive autoimmune diseases. And treatment must be individualized. Every single case I've ever seen, there's no two alike. What helps one condition may hurt another condition. So it's very personal. And medical and holistic approaches can coexist when properly guided. And the goal is regulation, not eradication of the immune disorder.
Now, what type of tests would a prospective patient expect to have to undergo in this journey? Can
Um,
you name?
Well, I'm not an immunologist, but let me check here for you. Might as well ask, right? What types of tests can you undergo for autoimmune disorders? I love this. Technology is your friend. Just remember, not everything is correct. Even in the medical side and any part of technology, you still need to have it reviewed. There's blood tests, the ANA. Yes, I know about that. That's the anti-nuclear antibody. There's inflammation markers, the CRP and ESR. They measure levels of inflammation. Auto antibody panels detect. Now, that's something that an immunologist would do. It's the dsDNA and SSA and anti-CCP. The rheumatoid factor, any physician can order it just to see if you have any rheumatoid arthritis. Complementary levels of C3 and C4 assess immune system consumption during active autoimmune disease. There's also organ-specified blood tests, and a lot of those your doctor already does. Thyroid antibodies, your TS3 and the T3, T4, TSH. I mean, there's various ones that they can do. Neurological tests, nerve conducting tests, EMG evaluates the muscle response from the nerve signals, and lumbar puncture tap, spinal tap. And of course, some of the normal ones, the MRI, ultrasound, CAT scans, tissue biopsies if they feel there's a need. Sometimes there is. If you're having a lot of pain in your tissue of your kidneys or something, maybe they want to check the tissue, you know.
So
Um,
there's a lot of basic blood tests your family doctor can start with, and then
right.
then you know what specialist you're looking for. Um,
Absolutely.
so there's all right. Well, before we go to the next section, then I guess we'll take another brief break, and we'll be right back.
Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant. Like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
Hi, welcome back to the Holistic Nurse with Peggy Smith and Dr. Gloria Warren. We're talking about fibromyalgia and CIDP as autoimmune situations that we're focusing on today. Gloria, what would you like to mention here?
Well, we started with some diagnostic tests, and we started with blood tests. There are some simple ones your doctor can start with, and there's others that you can get too, but your doctor may need to refer you to an immunologist to actually order those tests. Each type of doctor can only order tests pretty much that are within their realm of what their expertise area is. But there's other tests too that can be done, and like a nerve conduction study, a test that measures how quickly and effectively electrical signals travel through the nerves to identify damage or demyelination. That's that myelin sheath again at the end of the nerve. It's a coating. By the way, there's a good complementary medicine that I can talk to you about when we get to that section. So stay with us here, So why does this matter? Nerve conduction studies. It helps confirm whether symptoms are caused by true nerve injury rather than pain amplification or muscle fatigue alone. Remember, fibromyalgia is the amplification of pain. And then your CIDP is actually more of the actual true nerve damage on the myelin sheath at the tip of the nerve, at the end of the nerve. So this is going to help delineate which one are we looking at out of those two disorders. Of course, there's so many other disorders and immune system circumstances, but if we're just talking about these two, there's a very big difference on what causes it and what tests can be done to see which one it is. So that's where that one comes in play, and it really helps the physician figure out which one they're dealing with. They don't have microscopes to look into the nerve itself in their offices. So, and then you have the EMG. You've heard of EKGs and things with your heart, and EMG and EEG. It has to do with your brain and the signals that come to your brain. It's a diagnostic test that evaluates the electrical activity of muscles to determine whether weaknesses is caused by nerve or muscle dysfunction. So they can do a test that it will distinguish neurological weakness from muscle-based or functional causes guiding appropriate treatment. So when we talk about functional, maybe you have swollen muscle, maybe you've been over-exercising and you have too many waste products in your muscle tissue. So maybe it's caused more from that. They need to delineate, is this actually something to deal with these other two disorders, or is this something that's localized? And an EMG really helps with that. They check too to see with that test they'll check the EEG. I didn't have it. I wasn't going to speak about it, but it also helps to, they time when they stimulate, let's say they stimulate this finger, and they're checking your brain to see how long it takes for that message to get to your, it's milliseconds, to get to your brain. They poke your finger to create a, little pain. They see how what's the level of pain your brain is reacting to. If it's too high for what you're doing, there's something that they need to look further into. Then they can do do an elevated spine fluid protein check, and they'll increase the protein levels in the cerebral spinal fluid that signals inflammation or nerve damage without infection, of course. And this matters because the key biological markers supporting an autoimmune mediated nerve disorder like CIDP. So if they find the biological marker, they're going to know they're dealing more with CIDP. And then, of course, we have things like an MRI, image results that can show nerve root inflammation. So that's really taking it down. They can't do it in their office. They can order the test. A regular physician may want to refer you to a specialist because there's so many little things delineating. That's not an area without the expertise you normally would know much about. So send them to the specialist and they do an MRI. They check the tips of your root and see if there's any myelin sheath damage, maybe they can find on that, or root inflammation, thickening or enhancement consistent with immune-mediated nerve injury. So progressive weakness is a pattern muscle strength loss that worsens over time, often indicating an ongoing neurological or immune process rather than a temporary condition. And that's something, if it's progressive or long-term, you need to have it checked out. I was going actually through this. I don't know if you know this.
Yeah.
I was going through it this past spring. I was just so much fatigued that even if I got 8 hours sleep, or one day I got 9, I was just so tired. And it was my immunity. My immunity was low, and it was just creating all these problems. So of course I recognized it, and I helped it before it reached to the level of seeing a physician. I was really lucky that I knew what to do. This information is very valuable to our viewers. These are things that if you know somebody having these problems, please pass it on to them. Maybe they can figure out some other tests that the doctors can do if they haven't decided which they have, which problem. You can always add information and add research to what your physician knows or doesn't know. Okay. So it
With
does.
CIDP, it's been my experience. I've had
Mhm.
children as young as 9 months on taking immune globulin infusions. So as a young parent, you wouldn't expect, maybe your child's at daycare and he's getting a cold all the time. He's catching everything that comes down the pike. Oh, it's because he's in daycare. Maybe he's got chronic ear infections, but then the doctor's already put tubes in his ears and there's still problems. Um, and that's when they check the IgG levels, the immune level, blood levels, and they discover even with young children and the immune globulin therapy,
Mhm.
children can actually. Oh, and sometimes they call it primary immune disorder when you're a baby or a toddler, but it's basically the same thing as what ends up being CIDP when you're an adult.
Right. Right.
You know,
And with these tests, fibromyalgia doesn't show up on any of the imaging type of tests. So if it shows up on the test, it's most likely CIDP. So it's all done clinically based on symptom patterns and exclusion, which in this case would be deductive reasoning. Okay. So yeah, they do most of their diagnostics through deductive reasoning. So
and it's on some level, that's one of the positive things that AI can assist. Maybe it saves a few years or months, getting to the diagnosis or at least having it considered. I think the way medicine is looking at AI, they're just not taking it as, science of the Bible when AI comes up with AI gives you possibilities, then the doctor does further.
possibilities. I like that word. That's what it does. It gives you possibilities. There are a lot of errors in AI.
Yes.
And every day there's some that are corrected and some others that come out, but It gives you possibilities to discussion points for your doctor.
To consider. Absolutely. Let's talk for a few minutes about some of the holistic ways of building up your immune system and managing these symptoms.
Well,
Everybody seems to know, yeah, vitamin C and zinc is what you're supposed to take for your immune system. I
oh
don't think
yes.
it's quite that simple, though.
Well, you do have zinc therapy. It does help to hinder viruses from reproducing. That's exactly what zinc does. It doesn't stop viruses, in their tracks or kill viruses. It's like a viral birth control pill per se. And then there's if people are doing any zinc out there, I'm just going to warn you. Too much zinc can upset your red blood count. It can upset many things in your body. It can give you, you get a CBC, complete blood count, plus a differential where they do a microscopic. You'll get very abnormal red cells in there, shaped very weirdly, and it can throw the doctor off if you're not telling them you're taking zinc. The other thing is the amount of zinc you take. If you're coming down with a cold or you're having some autoimmune disorders and you want to try it, 50 milligrams twice a day, just for like 3 days, and then go down to once a day. And then after that, after about a week, 2 weeks tops, you drop down to 25 milligrams. Zinc does have a toxicity level in your blood. So, some of these complementary medicines, I'm an herbologist, but everything has a drawback too. And I remember I was on this radio show in New York, and he was like, "Oh, it sounds so gloomy." I said, "No, the thing is you just it's knowledge is power. You need to know where the limits lie." So,
And you need to be open with your medical providers if you've on your own
exactly,
gone and sought some of these holistic options,
yeah,
so that it doesn't,
right,
interfere or contradict anything.
yeah,
And
and
doctors
then
are useful. They're supposed to be asking, and they always do now in the forms, what over the counter do you take? Well, vitamins are over the counter. They need to know what you're taking.
so for me, because my immunity is low, I can tell you about that, and maybe it's something that you would consider with your diagnosis. I take a nicotine NAD plus once a day, and it seems to be helping. I'm also doing on an anti-parasitic cleanse, and it's helping. I also take DHEA, small dose, because you can get too much. So, and you need that checked every now and then, by the way. And then I take a multiple vitamin, a really good one without any calcium carbonate in it, because calcium carbonate, I find, in my experience and research, is not good for your body, causes other problems. But the main thing is, like if my body starts hyper reacting to things in general, I put a little baking soda. If I drink coffee in the morning, I'll put baking soda in that coffee, just like a quarter teaspoon or less, because I don't like the taste, but I'll put it in everything I drink, a little pinch here and there. It raises my pH level up. My pH is very low. It's like a 6.3. Sometimes it goes down to 6. So I find that all my allergies, all my immunity starts overreacting, kind of like a Graves' disease situation, hyperthyroidism and overreaction to everything. But if I get my pH up, my body stops hyperreacting. My myelin sheaths are not being eaten up anymore when this happens. It's not an easy task, but you definitely can do it. You have the physical integrative therapies, your acupuncture, massage, energy-based therapy. I'm also a Reiki master. So, and I think Peggy, you are too, right?
Yes.
So they can all enhance resilience and decrease symptoms and symptom control, but my thing is what I told you, what I do for me, and it raises my immunity and it buffers my system pretty much. So the acids in my system are not eating at my nerve endings. Simple chemistry there, folks. Just think about it. There's so many different options like that. There are certain things that you can take as far as holistic herbs, easy peasy. Go online, see what there is that will help your symptoms that you're having that day. Okay, like anxiety sometimes kicks in. I'll just take a valerian capsule, or I like valerian drops. They're better. You can regulate 2 drops, 10 drops, depending on what your needs are. Your mind, it doesn't make you sleepy. It just makes you keeps you clear-minded, but it eases your nerves, it relaxes them. So those are my top picks for the day.
Okay, we're going to take another brief break and we'll come back for the closing. Thank you.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation.
Hi, welcome back to this week's edition of The Holistic Nurse with Peggy Smith, and Dr. Gloria Warren is with us today. We're talking about autoimmune, specifically CIDP and fibromyalgia. Doctor, do you have some closing thoughts about that?
It's all about getting the right diagnosis and then getting the right treatment, as well as helping yourself. And I think we talked about some of the treatments focusing on stopping the immune attack, whether it be the IVIG, the intravenous immunoglobulin, that, it's made from purified antibodies collected from healthy donors, and it's given through a vein. This is what Peggy does for a living, things like this. And there's corticosteroids that can help plasma exchange, rehabilitation, where they can get, work in different ways of you accepting the pain, working with the pain, how to mitigate the pain, how to ward off the pain so it doesn't come up to a full, just like when you get a migraine. Sometimes if you take the medicine early, it doesn't get to a full-blown migraine. And, there's things that can be done with the pain. And fibromyalgia treatment focuses on calming and retraining the nervous system, restorative sleep, gentle movement, stress reduction, pain mediation and modulation, nervous system regulation, treating one like the other. If the other doesn't work, try a different method. Not anybody has the same two exact situations. So it's finding those niches and seeing what works for you.
I think too, in our changing medical insurance environments and availability of professionals and everything, 2 decades ago, we just assumed, the doctor was, had a direct bat phone to God, and he knew exactly what to do for us. And, he didn't really even listen to, many doctors didn't honestly listen to the patients. They were so focused on spitting out what they learned in school, didn't realize that each person is an individual. The doctors are much better, being trained better with that respect. But the bottom line, especially as people get, people that have chronic illnesses often feel like, well, there's nothing I can do. My hospital closed. My doctor's too far away. Um, this is just my lot in life. I'm supposed to suffer until I die, and nobody is supposed to be responsible for you but yourself. That's what it comes down to, really. And that's why if you don't agree in your gut, something that a professional is telling you, they're not the last word. You seek a second opinion
Mhm.
or a third opinion until something resonates. And if you're on prescribed typical pain medicines, usually a pain doctor specialist has to prescribe them nowadays. So don't be angry with your family doctor when he can't prescribe, the opioids that you were hoping for. But understand too, many people, when they are on this prescription pain medicine, they wait till it's too late, till the pain is unbearable, because they either want them to last as long as possible, it's the script, or and if you know certain situations, like we tell people going to physical therapy, take your Tylenol before you come, so that when we start moving you around in the gym, you've got some support there. And exercising is one of the best cures for adjunctive therapies for pain. Because if you're in pain, you tend not to be more immobile. You're not moving your joints and body parts. It's going to just get worse. If you don't use it, you're going to lose it. So even mild
Mhm.
exercises, yoga, um, the acupuncture, those are all things that work with your chakras. It's not hocus pocus. There's a scientific basis to all of the different techniques, and one size doesn't fit all. So,
Right.
if your Aunt Mary, got acupuncture and everything was great, you try it and you have a needle phobia, it may not work so well for you. Uh, and if you expect because you have a chronic diagnosis that there's nothing you can do, that's what the message you send your brain, and your brain's not is going to give up trying. Um, I
Yeah.
think research shows your brain wants to please, and so you need to send messages to your brain that, I'm in this with you. How can we work together and,
Mhm.
uh, to be most effective to conquer this, because nobody wants to be dependent in the end on family members and, public facilities, things like that. You want your independence as long as you can. And these are not, normally, um, life-ending situations. They make life a little more challenging, but you can have a quality, productive life. You can be happy. You can enjoy your family, and that doesn't mean you just hide your pain and suffer in silence. But you maybe focus on gratitude. Focus on the family that's supporting you. Or if you've got a family that you don't want to support you, then be grateful that you recognize that and find your support somewhere
Mhm.
else. Nobody's family is
Yeah.
perfect. Um, so we just have a couple minutes left. Gloria, do you have a closing
Yeah.
word?
Yes, I just want people to realize you can have CIDP and fibromyalgia all at once. Some of the CIDP situations trigger central sensitization, which can create fibromyalgia like pain. So, yes, you can have the symptoms of both. So, if you go through testing and they're finding, oh, we think, this is CIDP, but you're getting fibromyalgia like pain, yes, it's possible. But structural damage and pain amplification can coexist. This is why individualized care really does matter.
So it's important to make a plan with the new year coming. You're in charge of your health. You're in charge
Mhm.
of your future, your destiny. Um, and if you're prescribed one of these very expensive medications that they use sometimes, and financially you just, don't discount it. The major pharmaceutical companies have payment assistant plans.
Yes.
Sometimes you get it completely free. You just have to let them know you can't pay, $1,000 a week for this medication.
Hmm.
And there's help out there. There's copays. There's actual complete coverage. So don't let that be your excuse not to look into what's available, and
Yeah,
do
and
what
they
you need.
sometimes will say, you're just too high and you're over the maximum of income for us to help assist you with. Then ask them, do you have a sliding scale? Is there some portion of this at least you can take off for me? Ask
Well,
them. It
there may
doesn't hurt.
be autoimmune, like the Multiple Sclerosis Society offers people copay assistance. There
There you
are
go.
there are CIDP societies. There's choices. So as we're closing today, I guess just wish everybody a happy holidays. If you are celebrating in this week, we want everybody to continue to be healthy and take charge of your life, because that, in the
If
end,
you
that
don't, you will.
yeah, absolutely, and it's better to
Yeah.
be in control and make your own choices when you can. Thank you for joining us, Dr. Gloria, and thank you everybody for joining our show. Pass this on to people that would need this information, and like and share us, and we'll be talking to you in the future. Thank you. Have a good day. Bye-bye.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, 1 p.m. Eastern.